Good afternoon, everyone, and welcome to today's call. We are delighted that all of you can join us. For those of you on the West Coast, we wish you a pleasant good morning. I know it's a little bit early, but we thank you that you were able to join us for today's call. We have on today's call the Area on Aging Administrators, state units on aging, primary care associations, and health centers from regions 9 and 10. And these would include the states of Alaska, Idaho, Washington, Oregon, and then the U.S. territories. So we are delighted that all of you can join us on our call today. This is an opportunity for you to learn about how HRSA grantees and ACL, AOA grantees are working together to improve the health care of seniors in your territories. Before we begin, I'm going to give you a little bit of overview of who we are here at North American Management. The project that we are currently working under is the National Center for Health and the Aging. This is a project of North American Management that is supported in part by a cooperative agreement awarded to us by HRSA in September 2011. The National Center for Health and the Aging provides training and technical assistance to strengthen the capacity of federally qualified health centers to increase access to care, eliminate health disparities, and enhance the health care delivery for the 39 million people, or 13% of Americans aged 65 or older. Because of the unique needs and the various needs of the seniors, we have tried to provide as much in terms of targeted outreach and assistance so seniors can access health care services that are necessary. In order to increase the capacity and improve the performance of the HRSA-supported health center grantees and other safety net providers, we here at the National Center for Health and the Aging have developed several informational materials, training and educational opportunities, and disseminated best practices and mentored our new grantees working with seniors. This work that we do would not have been possible without the established collaborations with many of our national and state aging agencies. We are really delighted a little later to hear from one of our national partners who will kind of give you an overview of how we are working together and the opportunities, resources that are available to help you, especially our health center grantees. In addition to that, I do want you to be aware that we will be holding our National Annual Aging Symposium in April 2013 in the Washington, D.C. area. We really encourage you to go to our website at www.healthandtheaging.org, where you can sign up for our mailing list so that you would receive all the announcements of this upcoming symposium. Again, we will be working very closely with the National Council on Aging as they have a similar meeting in the Washington, D.C. area. So it is truly an opportunity to bring together the health center programs and the aging networks who can be working in your region to really meet the needs of seniors there. In addition, on our website, you're going to find a calendar of events which include a series of webinars and other opportunities that we have for training and technical assistance for our health centers. We have also invited on many of these opportunities the aging networks from time to time. So they do present, as you will hear today, just like our grantees on many of these webinar training opportunities. We will have similar type workshops also available at our National Symposium, and so this is another opportunity for the health centers to be trained on senior health issues. So again, please feel free to visit our website. At the end of the presentation, I will also share my contact information. Today's call will be recorded to benefit those who, especially on the West Coast, who were not able to participate this morning, but they will be able to hear some of the information and learn of some of the partnerships that are happening in your region. I just want to give you a very quick overview of the number of patients being seen in your regions. In Region 9, currently there are about 3.8 million patients who are being seen by health centers in your region. And in Region 10, there are approximately 1.285 million patients being seen. In Region 9, we have a total number of 158 community health centers, and in Region 10, there's a total of 88 health center programs who provide care. Now, in general, the total number of seniors in Region 9 are estimated to be about 224,601. And in Region 10, there are about 81,628 seniors. And these numbers are based on the information that we had available through the UDS and the aging networks. The health center programs in Region 9, California health center programs to have served the most number of patients and the most number of seniors, as we have seen from the data in 2011. California also has the most number of health centers. In Region 9, which also contains the U.S. territories, many of them have only one health center. In Region 10, the number of health center programs in Washington State serve the most number of patients, and many of them are included seniors as of the data of UDS 2011. However, Alaska, Oregon, and Washington have the same number of health centers. So we do see that there are a lot of our health centers who are currently serving seniors in your regions, but truly there is still a lot of needs to meet the senior health care. And so we are delighted that HRSA and ACL have collaboratively at the federal level come together to discuss ways and opportunities for their grantees to work together. So with that, I would like to invite Mr. David Ishida, who is the Regional Administrator for AOA for Regions 9 and 10, to just share a few words about this partnership and how it's impacting Regions 9 and 10. Thank you, David.
Astral, thank you so much for your assistance in this and leadership. And I also want to thank Sue in advance for all of her support from the National Council on Aging. I'd like to extend greetings to everyone on the phone from our administrator of the new Administration for Community Living and Assistant Secretary for Aging, Kathy Greenlee. As many of you may be aware, we just formed a new organization within the Department of Health and Human Services this past April to form this new Administration for Community Living. It's in partnership with the Secretary's Office on Disability, the Administration for Children and Families Administration on Developmental Disabilities, and the Administration on Aging. So I want to briefly let you know that our role is to help distribute funds and create policies and different programs for and under the Older Americans Act. It establishes our National Administration on Aging and helps create the National Aging Network, which funds a state unit on aging in each state and a network of area agencies on aging throughout the different areas within a given state. there are tremendous opportunities for the aging and disability networks to work together along with our primary care associations and our community health clinics. We will be providing you with information on who our leaders are at the state unit level. We hope that we can help join the different area agency on aging state associations with the state primary care associations, as well as the state independent living councils. We also, at the local level, want to engage the cooperation between community health centers, area agencies on aging, and independent living centers. There are so many areas that we are working together in helping to meet the health needs of seniors and persons with disabilities at the local level. And we also want to add that the individuals who are living in the community have tremendous support from their family caregivers. We want to pay attention to those that have chronic diseases. We want to try to identify those individuals that may have these diseases that would to help them reduce hospitalization and readmissions. And we have a tremendous opportunity to partner on community education programs, and I'm just delighted that so many of you are able to join us today. So with that, Astral, I'm going to turn it back.
Okay, thank you so much, David, and greetings to the Assistant Secretary, Kathy Greenlee. Thank you so much for joining us. And we do appreciate the leadership of all the area agency on administrators and NCOA in really helping us move this agenda forward to really provide that bridge and close that gap for senior care. So thank you again for everything that you're doing, your leadership, and we're really delighted to learn a little more about what's happening specifically in your region. So with that, I would like to introduce our next presenter, Alejandrina Arezaga, who is the COO of La Maestra Health Center in San Diego. This is one of the HRSA grantees that has been doing a tremendous amount of work in terms of really doing that outreach to seniors in the community. And so she is going to share a little bit about some of the work that they are doing now. Good morning, Alejandrina, and thank you for joining us today.
Good morning, Dr. Webb. How are you? How's everybody? Greetings from rainy San Diego, California. It's the first day of rain for us here. Normally we have very, very nice weather. Is everybody there? Hello?
Yes, we are all here. We are
Okay.
all here. Thank you.
Thank you. Well, La Maestra has been working with seniors in different programs. We started about 5 years ago with a geriatric clinic with a geriatrician from UCSD that comes here twice a week to see people over 60 years old with chronic diseases and people over 65 years old. And it has been very successful. The way that this has worked is when he comes, he works with a social worker and with a medical assistant and the nurse. And they do an intake on the patient, and they try to take care of the needs of the socioeconomic needs of the patients. So that helps the seniors a lot in their physical health. I think it has been very successful because Dr. Jairo Romero is very, very experienced. He has vast resources for referrals to people to UCSD and other specialists in the area. And he has very good communication with the health plans, the local health plans. So the authorization for services comes very easy. To enhance the services, we have had a senior promotora program since 4 years ago, almost 5 years ago. This is through the mental health funds, through the County of San Diego and the San Diego Council of Community Clinics, and we have a subcontract. And what this does is we hire and train promotoras to reach to seniors for depression, anxiety, and mental health issues, as we know that's very prevalent in seniors. So it has worked very well. We still have it. We have met all our goals. There's about 15 promotoras that have been trained, and it's an ongoing effort. Of course, we work with many other agencies too in collaboration so that we can serve as many patients as possible. We also have another program. This is with the Southern REACH program. This is a mental health program, and the program is called REACH, R-E-A-C-H, and it is to reach the caretakers of people with Alzheimer's in particular. And what the community health workers do, they go out into the community every single day, and they interview people and recruit caretakers to come into the training programs on how to help themselves when they have to take care of seniors with disabilities or illnesses. So all of these patches up or puts together a very extensive program for seniors in our community. We're also right now in the middle of starting what we're going to call a Generations program, and the Generations program is will provide social services and programs where seniors can come in the morning and discuss their issues. We will have trainings in different arts and crafts. We are going to have mental health counselors so that people have a place to go where they can feel better, feel safe, and receive services and talk to a social worker so that we know how we can assist them in their day-to-day living. In the afternoons, the Generations program will have a teen center that eventually we will couple that with the seniors so that they can help each other, as coaches or as partners, as mentors, or different ways like that. We have already hired a coordinator that is going to do this. We're very proud of what we have done. It has been very effective, and we have received many letters of support and commendations from the county and from the aging agencies locally. I would like to entertain questions if you have any, or at the end of the presentation, please do.
Thank you very much, Alejandrina. And I think one of the things that we've seen is that this health center, just like many of the other health centers who serve seniors, have had to find very innovative and creative ways of providing care for their patients. Even though the health centers provide primarily primary and preventive care, there's a lot that they're doing to also connect those that they serve in the underserved populations with those other type of services to support mental health and well-being in general. And, I do know that many of the programs here in California, as an example in your region, have very similar type structures, and one of the strengths of that program is the ability to use the promotoras, or some people call it the community health workers or patient navigators programs. So I know that even in working with some of the aging networks, these are some of the programs through which a lot of the health centers are currently participating. But we do know that there is still a lot more that we can do in the region. As you know, the HRSA grantees are charged with making sure they provide that patient-centered medical home model for their patients, not only so that they can make sure that there's full access to high-quality care for those patients that they serve, but also it's an opportunity to make sure that the entire community is healthier when all of those individuals living there have that medical home to go to. So we've seen, and I know Ali didn't mention that, but they actually have those similar type walking programs and fitness clubs and garden clubs for their seniors there. So not only does it help address some of the healthcare issues, but also the leisure time activities for those seniors who are isolated and have various behavioral health issues. So, in general, there are some challenges for our health centers as well because many of them serve a large number of uninsured patients. In fact, many of them in the senior population, over 50% of their patients are uninsured. And so, depending on the states that they're in, there is not a lot on the reimbursement end of things for some of the health centers. Some services are, and some of them are not. And what we've seen is that a lot of these health centers have found ways to try to augment those ancillary services that they really do not get reimbursed for. And so they have issues. Some of those things impact the daily lifestyle of the patients, from providing glasses and hearing aids and so forth to the just additional support. But what they don't have is one of the things that I think it's a great partnership with the aging networks is the ability to connect as well to the social needs of those individuals, whether their meals, and many of their patients do not have good nutritional meals. It may be issues of transportation and getting the patients back and forth to see a healthcare provider. For many of the programs, and I know that La Maestra is one of those health centers that has done a lot in terms of telehealth, telemedicine. So, Ali, can you just share a little bit of how you're using the telehealth part of it to provide services to seniors as well?
Yes, most effectively. We have had telemedicine or telehealth communication since about 6 years ago. We have used it in several ways. One of the first attempt with that, and we still continue to do it, is for mental health services. And it has worked very effectively communicating with the Indian tribes and Indian clinics and rural areas from our mental health providers in the La Maestra centers. At the beginning, it was a challenge for the psychologist. She thought she couldn't do it. But once she started doing it, it was fascinating for her and for all of us how easy it came about, because it's just the way she explains it is just as the same as if it was in the office. So that worked very effectively, and we continue to do that. We continue to use telemedicine to do the mental health programs within our own clinics, the one in El Cajon and Lemon Grove and National City, and that's how we provide the services to some of our patients, because most of them do not have transportation. As we know, patients in community health centers are very limited in the transportation. The transportation in San Diego is a little bit difficult. It's a large challenge for seniors in particular. The other way that we have used it is we have in an agreement with Scripps, with a cardiologist. We have used the services of Dr. Shaw, and he does conduct telemedicine from our office. We communicate with him, and he does the visit with an MA and the patient. And we also have connections with UC Davis, and we have an agreement with that any time that one of our doctors needs the telemedicine, we can hook up with one of the specialists over there. In San Diego, in particular, with the seniors, Dr. Romero has been exploring and trying to use the services of the specialists at UCSD for some of the needs that his patients have. It has been a little bit challenging because we have to go through the hurdles of having their connections and talking to ours and all of that. But I think that is the next step that we're entertaining for February. Overall, I can tell you that telemedicine works. It works for our patients, and it works for our doctors, and our doctors have been able to embrace it.
Excellent, thank you. And I will share with I know one of our grantees from Hawaii really wanted to be on the call as well, because they're using this as well to provide a lot of the, like Alejandrina alluded to, specialty care. It is probably one of the biggest challenges that we find right now for community health centers. Some of them may not have a geriatric specialists on board, and so they really have to rely on the referrals and the outreach, and really working with consultants who will be willing to give them those consultation services. In addition to that, case management, especially for specialty care, is one of the big areas of need. As we've seen in many of these, the populations that are served by the HRSA grantees, that really includes a lot of the public housing, the migrant, and the homeless populations. A lot of the seniors, especially those who do have a roof over their head, they do want to age at home. They do want to be amongst their family members or friends and in that environment. But in this population, you see multiple chronic diseases. Most cases, there are 3, 4, sometimes up to 7, 9 multiple chronic conditions: diabetes, hypertension, obesity, depression, arthritis, all of them on top of it, with many others. And so oral health needs, it's a big problem and challenge as well in this population. So through working with, through the work partnerships that many of the health centers have with providers who would provide some of those services, a lot of them are trying to figure out how do they get home health aid and home health care support within the home environment. And so I think this is one of the other ways that in the partnerships with the aging networks, I think a lot of health centers or some of them have begun to have those conversations of how they can work with that. And so I'm going to now invite Sue Lachenmeyer from the National Council on Aging, who has been one of our faithful collaborative partners and provided a tremendous number of resources that have come out of the Aging Network, all of them. And so we're really delighted to have Sue share with us, especially for the benefit of the health centers, so that you can learn more about some of the services and resources that are available through the Aging Network. So Sue, thank you so much for joining us on today's conference call.
Astral, thank you. It really is a pleasure to be with you, and also to thank David for his kind words and his information about the work that's being done under the ACL and the Aging Network. And my role today really is to provide you with some context and perhaps some opportunities where you can see linkages. And certainly, in many cases, it's clear that the community health centers and the Aging Network are reaching the same population. So the ways that we can find to leverage resources and coordinate efforts, I think, is a really important one. So as I said, I wanted to be able to share some various resources with you, and I think Astral's already talked about the current number of older adults in the communities, living within the communities, but recognize that while today there are about 60 million older adults, 60 and older, by 2020, that number is going to jump to nearly 80 million. So there really is the potential for reaching many more older adults who are going to continue to need increasing services moving forward. Just quickly, I wanted to give you a little bit of background. The National Council on Aging is a nonprofit service and advocacy organization. Our mission at the national level is to improve the lives of millions of older adults, especially those who are vulnerable and disadvantaged. And the NCOA Center for Healthy Aging is the national resource center for the U.S. Administration on Aging and the Administration for Community Living. Here at the center, we really are focused on improving the health and reducing disability among older Americans. We collaborate with many diverse organizations on national movements and look to identify and translate and disseminate evidence on effective programs, and to promote community organizations we really see as essential agents for improving the health of older adults. we really are looking to reach and engage diverse elders, including those who are most vulnerable, and we also do have a strong advocacy arm that advocates to support strong and effective community programs specifically for older adults. David Ishida talked a little bit about the Administration for Community Living and the Administration on Aging, which is under that umbrella. And their mission really is to help older adults maintain health and independence in their communities. And that's been expanded to include individuals with disabilities of all ages. Again, certainly a similar population to the ones that the community health centers are reaching. And a lot of the work that's done through the Administration on Aging is through what is known as the Older Americans Act, which was passed in 1965. It was passed really in response to concern about the lack of community social services for older persons. The Act created the Aging Network really to provide these services for community-dwelling older adults, as well as establishing the Administration on Aging. And that network is really remarkably extensive. So under the U.S. Administration on Aging and the Administration for Community Living, there are 56 state units on aging, 629 area agencies on aging, and 246 tribal organizations. And under that network, there are over 20,000 service providers and about 500,000 volunteers who are working to provide services and supports to about 1 in 5 seniors living in the community. So that certainly does cover meals. It covers transportation, hours of personal care, training and assistance for caregivers, many, many hours, millions of hours of case management, transitioning of individuals from hospital and nursing home into the community. And it also includes individuals who are completing self-management programs to help them live a healthier life. And we'll talk a little bit more about that in just a minute. One of the key components of the Aging Network is what's known as the Aging and Disability Resource Center, and these are available in every state. They serve as the information and referral resource, and they really are seen as a no wrong door open service delivery, again, for integrating a variety of services. For example, Alzheimer's and caregiver supports, care transitions, working with veterans, home and community-based services, as I mentioned before, meals and rides, options counseling, benefits counseling, and the evidence-based programs. So that's programs like the Stanford Chronic Disease Self-Management Program, a Falls Prevention Matter of Balance Program, evidence-based physical activity programs, and other programs. And I think what we've realized over the many years in partnering with AOA to deliver these programs is that healthy aging for the individual really does require systems change as well, and that what we really need are tools to help to deliver health benefits to participants and to change systems so that older adults really can become actively engaged and good self-managers of their own health. So through those primary principles, AOA, in partnership with the National Council on Aging as the Technical Assistance Center, has been working with the state units on aging and the Aging Network, most recently under the ARA grant, and we have a new grant underway, but the first one was really focused on 47 states, Puerto Rico, and the District of Columbia, to be able to provide access to the Chronic Disease Self-Management Program and to reach 75,000 completers. In the end, we reached well over that number in all but 4 states, which was really exciting work. And in addition to reaching those individuals and helping them to become active self-managers, we've really also been focusing on the strategic framework that's needed to really deliver and maximize proven self-care services and to bring really to scale these evidence-based programs and to enhance the sustainability of these programs within the community. Just quickly, some examples of some of the other evidence-based programs that have been supported through the Administration on Aging. There are a number of physical activity programs, Walk with Ease, Fit and Strong. As I mentioned, the self-management programs, including a diabetes self-management program. There's a program for pain, an enhanced wellness program. There are a number of caregiver programs, depression management and behavioral health programs, again, to help identify older adults at risk, whether it be from substance abuse, medication management, and depression, and then fall risk reduction programs as well as medication management programs. So again, those are all available. Information about them are available on the NCOA side, and I know that Astral can share those resources for you. I've included some slides on the resources that I'm talking about, and I imagine that she's able to post those or share those with you. So I did want to give you some specific examples of how some of these partnerships might work. And Astral was earlier talking about the many efforts underway within federally qualified health centers to attain patient-centered medical home recognition. And within the current version of the accreditation process, what is recognized and reinforced is the critical role of the patient in terms of self-management and the practice of self-management support through the clinical provider. With that comes the role of documenting self-management capabilities of the individual patient and documenting the goals, being able to determine and document that you've been providing tools and resources, to be able to counsel older adults or patients on healthy behaviors, to be able to assess and provide for mental health and substance abuse treatment, and to provide additional community resources. And in fact, I do have really a guide that shows where the chronic disease self-management program in particular can really be seen as a key component of NCQA patient-centered medical home standards. Many places woven in without the 6 required strategies. You can see where the chronic disease self-management really can be embedded, particularly under number 4, which is providing self-care support and community resources, which is really one of those must-pass categories, as well as documenting the provision of services that are culturally and linguistically appropriate. For example, the community-based program, Chronic Disease Self-Management Program, is available now in 21 different languages. It's a program that is delivered in the community by lay leaders, often promotores. I know that Astral was mentioning the use of promotores or community health workers and others who have chronic diseases, so that really the information is coming from individuals who are just like the patient and may be dealing with many of the same challenges and barriers as the patient. The other piece I wanted to quickly share with you is around an opportunity for diabetes self-management. And there is certainly an opportunity, we think, for AAAs and the Aging Network to partner with FQHCs around diabetes education accreditation, which occurs really through the ADA, the American Diabetes Association, or the AADE, which then will allow that partnership to obtain Medicare reimbursement through both the diabetes self-management training and the medical nutrition training benefits. And there certainly is, it's a complicated accreditation process, but it does allow for the delivery of the Stanford Diabetes Self-Management Program within that reimbursement strategy. And again, we're planning to do a shared webinar about this for your network in March. And certainly we continue to have resources and information about how those resources can be used. Just a quick mention also, I wanted to let you know that we oversee 46 states who are participating In fall prevention, there are coalitions in all of those states specifically around helping to reduce fall risk, improving safety of older adults in their homes and in the community. And we certainly have resources that you can link to there. We have a number of online tools for building systems, lots of lessons learned, best practices, online training modules, all sorts of resources that really can assist you when you are marketing and working with older adults. And we do have an online community as well, and we welcome any and all of you to become active participants in the resources that we have. Certainly the network that Astral has talked about, the federal partners, which really include AOA, CDC, the Centers for Disease Control and Prevention, HRSA, SAMHSA, and CMS are all really critical to ensuring that we can really reach and deliver services to those individuals, especially older adults who are frail and in need of both clinical and community supports. As I said, at the state level, there are the state units on aging, state public health departments, state Medicaid offices, and at the local level, as I mentioned, we've really been working as we've been implementing these various programs with nearly 7,000 host and implementation sites, which include a wide array, the area agencies on aging, healthcare systems, senior centers, senior housing, faith-based organizations, multicultural organizations, all are there to really assist in providing those local resources. And again, we have websites, the AOA website, NCOA. You can find your own area agency on aging by putting in your zip code. And again, I have all of that information on a slide, and Astral, I know, will share some of that with you. Thank you, Astral, very much.
Thank you very much, Sue. And I think it's really, really clear, especially for the health centers who have now heard that there are a tremendous number of resources that are available. And as Sue mentioned, I just wanted to quickly go through a couple of the links that all of you may want to consider, and making sure you check for additional resources. So our website at www.healthandtheaging.org, that has a tremendous number of resources, archive webinars, archive presentations, monographs, fact sheets, and so forth related to your populations that can be very, very helpful and resourceful to you. Many of these webinars, the expertise actually came out from the aging networks at the national, federal, and state levels. So we really want to encourage you to take a look at those as well and have your staff members take a look at them as well. HRSA.gov, remember that all of your grantee requirements and compliance issues, and especially all of them centered around patient-centered medical home, you can actually find a lot more information on that as well. And AOA.gov has a wonderful screening toolkit for elder abuse, and we know that this has been very, very helpful to some of the health centers who are now screening their senior patients for that. HIV/AIDS is another big one that we want to make sure that we have linked resources, especially for those patients who need to be tied to the social services in their states to support their better care and outcome. And again, Sue alluded to ncoa.gov, very resourceful for many of the webinars and materials that she alluded to. All of them will be linked to our website as well, but they do a lot in terms of training. So if there's opportunities in your states and in your regions, feel free. Please utilize and refer to their resources as well. N4A.org has a phenomenal elder locator tool that is really great for linking or trying to find out what's available as well for seniors in your area. and NASWA.org if you want to check them out for what's happening with your state, especially for your aging and disabled individuals there. And so, and then lastly, I have to say that we have to utilize your local primary care associations. We are, as they are one of our collaborative partners, they tend to be very connected to what's happening locally in your states. And in terms of reimbursement for senior care, and as things are shaping under the Affordable Care Act, your PCAs are a very reliable source to find out about the Medicaid, the benefits part of things. So we really want to encourage you to utilize all of these resources as sites, and please feel free to contact me here at the National Center for Health and the Aging. My direct number is 703-812-8822. Or you can contact me by email at awebb, like my name, AWEBB, at NAMGT.com. If you are a health center and you would like to connect with a local area agency on aging or local aging network, please and contact me. You can feel free to contact them directly, but if for any reason that you are not able to make that contact, connect with us and we will be happy to connect with the agency, area agency on aging directly, even through their state offices as well. And then for the aging networks, for those of you who have senior patients who do not have a medical home, know that these health center programs funded by HRSA stand available in your communities to provide access to not only just care, but quality care. And as you've heard from Alejandrina, there are a lot of them that are using some really great innovative ways of reaching and making sure that they have the services necessary. There is still a lot of work to do. I think there are a lot of tremendous opportunities, and we can reshape what healthcare looks like now for these seniors. For the health centers, it is important for you to recognize as well, like Sue alluded to, there is a growing number of aging boomers coming out there, and we have to be ready for providing that care that they need. And so this is a tremendous opportunity through that partnership that ACL and HRSA now have in trying to not only improve access, but improve the quality of life and health for seniors across the country. We would also like to share that there are grant opportunities available as well for many of these health centers and aging programs that may be coming together. I think the way it works in most of the states right now, I think there are opportunities that the health centers can actually pursue because most of them are 501c3 organizations, and the aging networks providing some of those supportive outreach educational type programs, patient empowerment type support. The health centers and aging networks that have pursued these opportunities are really doing tremendous things to meet those resources. So that is yet another way of making sure that what you're beginning to do now will continue to be sustainable in the future, and that it will continue to be something that's scalable throughout your communities. I want to again thank all of the leadership of HRSA and ACL, AOA for all they're doing. I must mention that on a HRSA side, without the HRSA corporate agreement, we could not do the work that we're doing. We have met some tremendous collaborations through the aging networks, and our mission is to make sure that our health centers at the local level are connected with the area agencies on aging at the local level so they can continue to do what they're doing successfully. And our HRSA initiatives, we work very closely with the branch chief, Tiffany Smith, and our project officer, Lieutenant Commander Kevin Bates. And then on the ACL side, we are in constant contact with Rick Nichols, Greg Case, and Michelle Wasco, who have been tremendous supporters and really have aided us to facilitate and strengthen the collaborations that we have. So I want to thank all of you who are AOA administrators, our state units on aging, our primary care associations, and our health center programs who have really taken the time out today to be on this call. This is an important opportunity. It can be changing for our communities. And as we're continuing, despite what's happening in terms of conversations with the fiscal cliff, we know that this is still that our work cannot stop here, that we must continue and must pursue forward. So, Sue, thank you again for sharing all the resources. We look forward to having most of you, if not all of you, utilize our resources, and whether it's participating through the webinars. For those of you who can come to the Washington, D.C. area and be part of our annual symposium, we welcome that. And we do, again, want to thank everyone for giving us their time today. I don't know, for those of you who are presenters, if any of you have any last comments, but we do know there are great things happening in Regions 9 and 10, and we want to really embrace those and highlight them.
Astro, thank you. This is David. I just wanted to help Sue out because she might have had a heart attack over there. Her website is www.ncoa.org, and we would like everybody to go check out the Center for Healthy Aging on that website, along with the benefits checkup. A lot of great resources that the health centers would find very helpful. Thank you.
Thank
David,
you so much, David.
And David, thanks for correcting that. And I just, again, am delighted to be on the call with all of you. We look forward to hearing from you. And if you need to contact us, absolutely, you can go through our website. And I know that Astro will continue to share any other ideas or concerns that you have and link us so that we can really move together in this process. Thank you.
Thank you. And for Alejandrina, thank you so much for getting up early to do this call with us. It has been rewarding, and I want to encourage you, like all of the other health centers on the call right now, to continue to strive to do the work that you're doing. That is what energizes us here at the National Center for Health and Aging, to really continue to do what we can to make sure that you're successful. So again, thank you everyone for participating on our call today. Feel free to contact me. My number again is 703-812-8822. And if you have any concerns or questions for any of our presenters, for any of our networks, and if there's information that you need, feel free to contact me. Again, everyone, thank you again for your time today. Goodbye.
Can you call Jeanette?